Hey everyone, and welcome back for another deep dive. Today we're going to tackle something that I'm pretty sure every single one of you deals with on a weekly, or not daily basis. Low back pain.
It's everywhere, isn't it?
Oh, it is. And I think it's one of the most common reasons people come see their GP, right?
Absolutely. We see it in so many different forms, from the acute twinges all the way to like chronic pain that people have.
Right. And it makes it tricky to treat, right?
Yeah.
Because there's so many different causes and ways it can manifest.
Absolutely. So, trying to keep up with all the latest guidelines and making sure we're giving our patients the best possible care is so important.
Exactly. And speaking of those guidelines, that's exactly what we're going to be diving into today, specifically focusing on exercise therapy for non-specific low back pain.
Yes, that's right. Because sometimes those guidelines can feel a little bit like a dense forest.
Yeah,
And we need a map to find the best, the most effective paths for our patients.
absolutely. So think of this deep dive as your map and compass through the world of exercise therapy for low back pain.
Yes. We're going to be sifting through all those latest recommendations, highlighting all those really important takeaways, and hopefully busting some myths along the way.
Love that.
Yeah.
All right, so before we get lost in the woods of exercise options,
Mm.
let's make sure we're all on the same page about what we're actually talking about here.
Yeah.
What kind of low back pain are we focusing on?
So we're focusing on non-specific low back pain, which means it's not caused by a specific disease like cancer or an infection or a problem with the spine itself, like a fracture or something like that. So it's that common garden variety back pain that I think, all of our patients come in with.
Okay, that makes sense. So it's kind of like the catch-all term for back pain that doesn't have a clear-cut cause.
Right.
Okay. But even within that non-specific category, low back pain is still pretty broad. How do we even begin to approach it in a systematic way? Like, where do we even start?
Well, the guidelines actually break it down for us based on how long the symptoms last. So we have acute low back pain, which is pain for less than 4 weeks. Then there's subacute, which is between 4 and 12 weeks. And then finally, there's chronic low back pain, which is pain that hangs around for more than 12 weeks.
Okay, so we've got our three categories: acute, subacute, and chronic. But why is it so important to make these distinctions? I mean, pain is pain, right?
Well, you would think so, but actually, the treatment approaches can vary depending on what kind of low back pain you have. So, what works for an acute episode might not be the best approach for, say, chronic pain, and vice versa.
Oh, okay. I see what you're saying. So it's not a one-size-fits-all approach. We need to tailor our treatment based on how long the pain has been hanging around.
Exactly.
Okay, well, let's tackle these one by one, starting with acute low back pain. What's the first thing that comes to mind when a patient walks in and they're like, oh, I threw my back out, like the classic?
Yeah, the classic. Honestly, the first thing that comes to mind is not bed rest.
Really,
Yeah.
I have to admit, like maybe I'm guilty of this too, but I think my gut reaction in those acute cases is to tell them, okay, you know, take it easy for a few days, rest up.
Mm.
Is that not the right approach?
It's interesting you say that because that's kind of where the guidelines get really interesting.
Okay.
They actually advise against bed rest for acute low back pain.
Wow. Okay. So no more Netflix and chill on the couch. What are we supposed to tell them? Just walk it off.
Not quite walk it off, but the guidelines do encourage staying active. I'm not saying like go run a marathon, but gentle movement is key.
Okay. So gentle movement instead of, yeah, the total rest. I'm starting to see the light here, but does that mean we should jump right into like a structured exercise program for acute low back pain?
Not necessarily. The good news is that most cases of acute low back pain actually resolve on their own within a few weeks.
Oh, that is good news.
So exercise therapy isn't routinely recommended right away.
Okay. So it's more of a wait and see approach for those acute cases.
Exactly. Reassure your patients that their back will likely heal on its own with a little bit of time and just, gentle movement. And we can give them advice on things like pain management and encourage them to gradually increase their activity levels as they feel able.
All right. So acute low back pain. Stay active, manage pain, and see how things progress.
Yeah.
But I'm guessing exercise therapy plays a much bigger role when we're dealing with the subacute and chronic low back pain.
You guessed it, yeah. For subacute and chronic low back pain, it's a cornerstone of treatment.
Okay. So I'm really curious, what is it about exercise that makes it so beneficial for those dealing with those longer-term back pain? I mean, I get that it's good for our overall health, but is there something specific about it that helps the back heal or manage the pain?
That's a great question. And the answer is actually pretty fascinating. The benefits of exercise go far beyond just general fitness. We're talking about positive impacts on multiple levels. Psychologically, neurologically, it has anti-inflammatory effects, and of course, it helps the musculoskeletal system.
Wow, okay, that's a pretty impressive list. So let's unpack that a bit. What's happening on that psychological level when someone with chronic back pain starts exercising regularly?
Well, for starters, exercise is a fantastic stress reliever. And we all know that stress can play a huge role in chronic pain. It's that kind of, the vicious cycle. You get pain, which leads to more stress, which leads to more pain, and so on. So exercise can help to break that cycle by reducing those stress hormones and actually boosting those mood-enhancing endorphins.
Right, so it's not just about strengthening muscles, it's about strengthening the mind's resilience to pain as well.
Exactly. And exercise can also help patients overcome something called kinesiophobia.
Chemisophophobia. Now, there's a word I haven't heard before. What is that, and why should we care about it when it comes to back pain?
Kinesiophobia is basically a fear of movement, and it's surprisingly common in people with chronic pain, particularly back pain. They worry that any movement will make their pain worse, so they just avoid activity, but unfortunately, that can actually make the pain worse in the long run.
Oh, so it's kind of a self-fulfilling prophecy, right?
Yeah.
The fear of pain leads to inactivity, which then leads to more pain and more stiffness, and then that reinforces the fear.
Yeah, exactly.
So how does exercise help to break that cycle?
Well, it helps people to kind of confront that fear in a safe and controlled environment. So by gradually increasing their activity levels, they can start to experience that movement doesn't automatically equal pain.
Okay,
And this can really help them build confidence and regain a sense of control over their bodies.
that makes a lot of sense. So we've got the psychological benefits, reduced stress, improved mode, and overcoming that fear of movement. But you also mentioned neurological benefits. What's going on in the nervous system when someone with back pain exercises?
Well, research has actually suggested that exercise can actually help reverse some of the changes that happen in our nervous system as a result of injury.
Okay.
These changes can lead to increased pain sensitivity, and they can actually make the pain feel more widespread and persistent.
So it's almost like exercise is hitting the reset button for the nervous system, helping it to calm down and just recalibrate its pain response.
That's a great way of putting it, yeah.
Okay, so we've got the psychological, the neurological.
hmm
You mentioned that exercise also has an impact on inflammation as well, right?
Yes, it does. Exercise has been shown to have anti-inflammatory effects,
Okay.
which is, great when it comes to back pain because chronic inflammation can contribute to pain, stiffness, and tissue damage.
So almost like exercise is a natural anti-inflammatory.
Exactly. It helps to kind of regulate the body's inflammatory response and reduce those chemicals that are actually contributing to the pain.
That's pretty amazing. So
Right.
we've got the psychological benefits, we've got the neurological, we've got the anti-inflammatory effects,
Yeah.
and of course, we can't forget about the musculoskeletal system, right?
Yeah.
What's exercise actually doing for the muscles, joints, and bones in our back?
I mean, it's doing a lot.
Okay.
Regular exercise helps strengthen the muscles that support the spine,
Okay.
and this improves stability and it reduces the risk of injury.
Okay.
It also improves flexibility and range of motion,
Right.
which are essential for a healthy back. And we can't forget about those intervertebral discs.
Oh, the discs. Those always seem to get overlooked.
They do, and they're so important for a healthy back.
They really are.
And they actually rely on movement to get the nutrients they need. So keeping those discs healthy means keeping them moving.
Right. It's a good reminder that our bodies are designed to move. And that movement is essential for nourishing and maintaining those structures in our back, from the muscles and the ligaments all the way to the bones and those discs.
Absolutely, yeah. And I think when we're talking about, subacute and chronic low back pain, exercise isn't just about masking the pain. It's about addressing the underlying issues and helping our patients regain function and improve their quality of life.
I love that. Okay, this is all fantastic information. But I can't help but think, it can't be as simple as just telling patients to go exercise, can it?
You're absolutely right. It's so much more than just throwing a bunch of exercises at someone and hoping for the best. Patient counseling is absolutely crucial before we recommend an exercise program. I would argue that it's as important as the exercises themselves.
Okay, so let's talk about the counseling piece.
Yeah.
What are some of the key things that we need to be discussing with our patients before we even start talking about, specific exercises?
Yeah, so we need to manage their expectations. Some patients come in and think that a few sessions of physical therapy will magically erase their pain.
Yeah.
So we need to set realistic goals. We want them to understand that it might take time and consistent effort to actually see those improvements.
That makes sense. It's like setting the stage for a long-term commitment to self-care
Yeah,
rather than just thinking it's a quick fix, right?
exactly. Yeah.
What else is important to cover in that initial conversation?
Addressing fears is another big one. So many patients, particularly those with chronic pain, they're afraid of making their pain worse. We need to reassure them that exercise is safe, even if there's a little bit of discomfort involved.
Yeah, how do we walk that fine line between encouraging them to push through some discomfort, but also making sure they're listening to their bodies and not doing anything that could actually cause more harm?
It's a great question. It's about emphasizing that some mild discomfort, especially when you're first starting a program, is actually normal and expected. It's that good soreness that you feel after a workout. It's telling us that those muscles are adapting and getting stronger.
Right. It's that I worked out and I feel it, but not the I think I pulled something kind of pain,
Yeah,
right?
exactly. We want to make a clear distinction between that normal discomfort and severe pain or neurological pain.
Yeah,
If they experience anything like sharp, shooting, debilitating pain, or any new numbness or tingling, those are red flags that really warrant stopping the activity and seeking medical advice.
absolutely. Okay, so manage expectations, address fears, and emphasize the difference between that good soreness and pain. That's a red flag. What else is important to cover in that initial counseling session?
One more important point, and this is a big one. Reassuring patients that common back abnormalities that we see on imaging, they're not necessarily reasons to avoid exercise.
Okay, you mean things like bulging discs
Yeah.
or a bit of arthritis?
Yeah, that's
Those
it.
findings that sometimes make us, cringe when we see them on an MRI report.
Yeah, exactly that. And lots of people have these findings on imaging, but they don't have any pain.
Right.
These anatomical variations, they don't necessarily mean that something's wrong or that exercise is off limits.
That's a really important message to get across, I think. I bet it takes a lot of anxiety away for patients who might be thinking, oh, my back's messed up. I can't possibly exercise.
Yeah, it can be really empowering for patients to understand that their bodies are actually quite resilient and that they can be active despite these really common findings.
Absolutely. Okay, so we've talked about managing expectations, we've talked about addressing fears, and we've talked about reassuring patients that their back is likely stronger than they think. This is all great information.
Yeah.
So once we've had these conversations and addressed any concerns, how do we actually go about building a personalized exercise plan for a patient? Is there like a standard set of exercises that work for everyone?
I wish there was, but
Ah,
unfortunately, there isn't a one-size-fits-all approach.
okay.
That's where your expertise comes in as a GP.
Okay.
The exercise plan needs to be tailored to each individual patient,
Okay.
taking into account their needs, their goals, and their limitations.
Makes sense. So what are some of the factors we need to consider when we're creating that personalized plan?
So the first and foremost is their current activity level and experience with exercise. Someone who's already quite active will have very different needs from someone who's, say, been largely sedentary.
Right. You
Uh,
wouldn't want to throw someone who's never exercised before right into an intense boot camp.
Exactly, yeah. It's about gradual progression and building up tolerance. Another factor is the patient's preference. Do they want supervised exercise or do they want to do it independently?
Okay, so some people might thrive in that like group class setting, whereas others might prefer to do it solo.
Exactly.
Yeah.
And then, of course, we need to think about practical things like, what resources are available and cost. Not everyone has access to a gym or a personal trainer.
Absolutely. Real world considerations. So
Yeah.
important. So how do all of these factors influence the level of supervision we might recommend for a patient?
Okay, well, patients who are already active and feel quite comfortable exercising on their own can generally continue doing so, obviously with our guidance.
Right.
But for those who are new to exercise or have significant limitations, a more structured program with some level of supervision can be really helpful.
So maybe starting off with physical therapy to kind of learn the ropes.
Yeah, that's a common and a really effective approach. Physical therapists are experts in assessing those movement patterns, tailoring the exercises and making sure the patients are doing them correctly.
Right. And I imagine that also helps build confidence, especially for those patients who might be a bit hesitant or fearful of starting.
Exactly. Having that expert guidance can really make a difference in helping them feel safe and empowered to move.
Okay, so we've covered a lot of ground. We've talked about different types of low back pain, the importance of exercise therapy, particularly for those subacute and chronic cases. We've talked about all the multitude of benefits, the crucial role of counseling, and the need for personalized plans.
Yeah, it's a lot to take in.
It is. It is a lot to take in. But, there's one more thing I want to address before we move on. It's kind of the elephant in the room, that fear that many patients have. What if exercise makes the pain worse?
The million-dollar question.
Yeah,
It's a very valid concern and one that we hear all the time.
all the time.
So let's talk about that. So the big question, will exercise make my back pain worse?
Right. It's the fear. It's what keeps people, I think, from really embracing exercise as part of their treatment plan.
Absolutely. And, it's a completely understandable fear. No one wants to do something that's potentially going to backfire and make their pain worse, right? But the good news is that, while some short-term increase in pain is possible, especially when you're first starting out,
Okay.
exercise overall doesn't increase the risk of having, more low back pain or making it worse.
Okay. So you're saying that some increase in pain is possible. But how do we, as clinicians, help our patients understand that? Because wouldn't that just send them running for the hills?
Yeah, and that's why that initial counseling piece that we talked about is so important. We need to prepare our patients for that possibility and explain to them that it doesn't necessarily mean that they're doing damage.
Okay, so how do we frame that conversation? How do we explain to them that a little bit of discomfort might actually be a good thing?
A good way to think about it is like when you're working out a muscle and it gets stronger, you get those little micro tears,
Yeah.
and it's that repair process that actually makes the muscle stronger.
So it's kind of like the no pain, no gain idea, but
Yeah.
maybe a little less extreme on the pain part.
Exactly, yeah.
Yeah.
We want to really emphasize that discomfort they might be feeling is a sign that their body's adapting and getting stronger. It's like their muscles are saying, hey, we're getting a workout here. We haven't used these muscles in a while, so we're going to feel it.
Right, right. It's like, hey, I'm alive.
Exactly.
Okay, so we're framing it as a positive sign, a sign of progress. But how do we reassure them that they're on the right track, even if they are experiencing some of that soreness?
So the most important thing is to emphasize that exercise overall doesn't increase the risk of making their pain worse or exacerbating their pain. Studies have shown that actually people who exercise regularly are less likely to have recurring back pain.
Oh, that's good to know. So in the long run, it's actually protective, even if it's a little bit achy in the short term. But how do we help them differentiate between, like, what we might call good soreness and pain that's actually a red flag, a sign that maybe they need to stop or modify an activity?
Right. So we really want to make a distinction between discomfort and what we would call severe or neurological pain. Mild discomfort, like muscle soreness, is normal and expected, especially after a good workout, and it usually goes away, in a day or two.
Right? It's that familiar feeling you get after, like a hike or a good yoga class.
Exactly, yeah. Your muscles might be a bit tired, a little bit stiff, but it's a good feeling, a sign that you actually challenged yourself.
Exactly.
But if you're experiencing, severe pain, something that's sharp or shooting or debilitating, or any new numbness or tingling, that's a sign that something else might be going on. And it's really important to seek medical attention.
Okay, that makes sense. So it's really knowing what's normal and what might need further investigation.
Mm.
Okay, so let's say we've got our patients on board with exercise. We reassured them about the potential aches and pains. Now let's get to the fun part, the actual exercises. What options are out there for people with low back pain?
Well, you'll be pleased to know that there's actually a whole range of exercise modalities that can be helpful. And they all have their own sort of pros and cons.
Okay, I'm all ears. What's
Yeah.
on the menu? Give me the lowdown.
Well, let's start with the foundation of, I think, any good exercise program. Aerobic exercise.
Okay.
We're talking brisk walking, running, swimming, cycling, anything that gets your heart rate up and improves your cardiovascular health.
So good old cardio.
Yeah.
I always tell my patients, cardio is good for everything.
Yeah.
But what makes it so specifically helpful for low back pain?
Right. So a healthy heart pumps blood and nutrients efficiently through the body, including to those back muscles and spinal structures.
Makes sense. It's like giving your back all the fuel it needs to heal and stay strong.
Exactly. Aerobic exercise also engages those large muscle groups, which helps to strengthen the back and improve endurance. And then plus we have that mood boosting effect of endorphins.
That runner's high. It's like nature's pain reliever.
Absolutely. So aerobic exercise is a win-win.
Love it. Okay, so what about stretching? Where does that fit into the picture?
So stretching's all about improving flexibility and range of motion, which, as we know, are essential for a healthy back.
Oh, tell me about it. If I sit at my desk for too long, my back feels like a rusty hinge. A good stretch just makes all the difference.
I hear you. And there's just so many different stretches that target the muscles in the back, the hips, and the legs, all of which can contribute to that low back pain.
So it's not just about stretching the back itself. It's about addressing that whole, interconnected system.
Exactly. Tight hamstrings, for example, can actually pull on your pelvis and create tension in the lower back. So stretching those hamstrings can help to relieve that tension.
Oh, I never thought about it that way. So it's like a domino effect.
Yes.
Tightness in one area can cause problems elsewhere.
Absolutely. And the same goes for other muscle groups like those hip flexors and your quads.
Okay, so we've got cardio for overall fitness, and those feel-good endorphins.
Mm.
We've got stretching to keep things, loosey-goosey. But what about something a bit more targeted, like something that really zeroes in on those core muscles that support the spine?
So that's where Pilates comes in.
Okay.
It's all about controlled movements, core strength, and flexibility, which makes it, just a fantastic option for building a strong and stable foundation for your spine.
I've done a little bit of Pilates myself, and I can definitely see how those exercises would really target those deep, stabilizing muscles that you don't always work in other, like, more traditional workouts.
Absolutely. Pilates really focuses on activating and strengthening that transverse abdominis, which, acts like that natural corset for the back, as well as the multifidus muscles, which run along the spine.
So it's like building that inner support system for the back, like the scaffolding that keeps everything in alignment.
Yeah, that's a great analogy. And Pilates also emphasizes, good posture and alignment, which can really help to reduce strain on the back and prevent future injuries.
It all sounds very beneficial. So what about yoga? It's become so popular these days. Is it really a good option for people with low back pain?
Yoga is wonderful because it offers this amazing blend of physical postures, breathing techniques, and mindfulness, which makes it a really holistic approach to back care.
So it's not just a physical workout. It's also about, calming the mind and reducing stress, which we know can make pain worse.
Absolutely. The physical postures, or asanas as they're called in yoga, help to improve flexibility, strength, and balance. And those breathing techniques can help calm the nervous system and reduce tension.
Yeah, and I imagine that the mindfulness aspect of yoga really helps people become more aware of their bodies, their movements, and even their pain.
You're absolutely right. And that increased body awareness can be so helpful in managing pain and preventing further injury.
It's almost like you become a detective of your own body. You start to notice those early warning signs, and you can adjust your movements accordingly.
I love that. That's a great way to put it.
Thanks.
And one of the great things about yoga is that there are so many different styles,
Right.
from, gentle and restorative to much more vigorous and challenging. So it's easy to find a practice that really suits your patient's fitness level and their preferences.
Yeah, I love that there's something for everyone, whether you're, a seasoned yogi or a complete beginner. Okay, so let's talk about Tai Chi. I've seen people practicing Tai Chi in the park, and it always looks so graceful, so peaceful. But how does it actually help with back pain?
So Tai Chi is this gentle flowing form of exercise that originated in ancient China, and it's known for so many health benefits, including stress reduction, improved balance, and, increasing flexibility and strength.
That all sounds great, but how does it specifically target back pain?
So those slow, controlled movements help to improve range of motion in the spine and also strengthen those muscles that support the back.
So it's a gentle way to build strength and mobility, and, without putting too much strain on those joints, which is especially important for people who are dealing with pain or stiffness already.
Exactly. And the focus on deep breathing and mindfulness can also help to relax those muscles and reduce tension, which can lead to pain relief.
Okay. So we've covered aerobic exercise, we've got stretching, Pilates, yoga, and Tai Chi. But you mentioned earlier that there are even more options out there.
Yeah, there are a few more approaches that I want to highlight. One is the Alexander technique,
Okay.
and it focuses on improving posture, balance, and coordination
Okay.
by becoming more aware of our habitual movement patterns.
So it's almost like retraining the way we move,
Yeah.
like becoming more mindful of how we're holding our bodies throughout the day.
You got it, yeah.
Okay.
And for people with back pain, that can be a real game changer.
Yeah.
Because it's about identifying and changing those unconscious habits that are actually contributing to muscle tension and pain and just bad posture in general.
Right. So especially if the back pain is, maybe caused by poor posture or repetitive strain from, like sitting at a desk all day.
Exactly, yeah. And the Alexander technique involves Gentle, hands-on guidance from a trained practitioner who can help you, or help your patient, I should say, become more aware of how they're holding their body and how they're moving.
So it's like having a posture coach almost to help you fine-tune your alignment and your movement habits. That's fascinating. Okay, so we've got the Alexander technique for improving those kind of posture and movement habits. You mentioned there was another modality you wanted to talk about.
Yeah, so another one is called directional preference exercises.
Directional preference exercises. Okay, I'm not familiar with those. What are they all about?
So these are based on the idea that certain movements can actually centralize or peripheralize pain.
Okay, hold on a second. Centralize or peripheralize? What do those terms mean?
Okay, so centralization basically means that the pain moves closer to the spine,
Okay,
and peripheralization means that it moves further away from the spine.
got it. So it's all about the location of the pain, right? Whether it's
Yeah.
more concentrated or it's radiating outwards.
Exactly. And the goal of these exercises is to identify those movements that actually centralize the pain and then incorporate those into an exercise program.
So it's like a highly personalized approach
Right.
based on what feels best for the individual's back.
Absolutely. It's all about finding what works for you and for your unique pain patterns.
I like that. It's like finding a customized map for navigating your way out of pain.
That's a great way to think about it.
All right, so we've got Alexander technique for improving posture and movement habits. We've got directional preference exercises for finding those pain-relieving movements. What else is there?
So let's talk about the powerhouse trio: motor control exercises, core strengthening, and spine stabilization exercises.
Wow, those sound pretty intense. Are these the ones that really put those core muscles to the test?
They can be challenging, but they're also incredibly effective for strengthening the muscles that support the spine,
Okay.
improving stability and reducing pain.
So it's like we're building that internal corset that we talked about earlier, that deep layer of support that protects the back from injury.
Yes, exactly. These exercises target those deep muscles that stabilize the spine, including the transverse abdominis, the multifidus, and the pelvic floor muscles.
Okay, so we're creating that strong and stable foundation that allows us to move freely, confidently, without putting extra stress on our back.
Exactly. And these exercises often involve very precise, controlled movements that require, a lot of focus and coordination.
Right.
It's not just about lifting heavy weights, it's about engaging those deep, stabilizing muscles in a very mindful way.
So it's a combination of strength, control, and awareness all working together.
Exactly. And as you get stronger, you can gradually increase that challenge by, adding resistance or instability.
So it's a progressive approach that kind of builds upon itself. So helping patients gradually regain that strength and confidence in their back.
Absolutely. And then for those that are really wanting to push their limits and regain that functional capacity, there's these graded activity exercise programs. They're sometimes called back boot camps or functional restoration programs.
Back boot camp. Wow. That sounds intense. What do those programs actually involve?
So they typically involve a combination of progressive resistance training, some aerobic exercise, and stretching, all designed to really improve your strength, endurance, and your functional capacity.
So it's about getting people back to doing the things they need and want to do in their lives, right?
Absolutely. Yeah.
Whether it's, lifting groceries, playing with their kids, or getting back to a sport or hobby that they love.
Yeah, that's the ultimate goal.
Okay.
These programs have a strong focus on functional movements
Okay.
that mimic real-life activities like, lifting, bending, and twisting.
So it's not just about exercising in a gym. It's about preparing them to move confidently in their everyday lives.
Exactly. And then finally, we have what we call multidisciplinary rehabilitation,
Okay.
which is a really comprehensive approach that involves, a whole team of healthcare professionals
Okay.
all working together to address all those different aspects of low back pain.
So it's kind of like a one-stop shop for back care.
Yeah.
Right? You're bringing in different expertise to really create a very personalized plan for each patient.
That's a great way to put it, yeah. Multidisciplinary rehab typically includes a combination of exercise therapy, psychological counseling, some pain management techniques, and occupational therapy.
Wow. So it really addresses those physical, mental, and social factors that can, contribute to that back pain. It's recognizing that back pain isn't just about the body, it's about the whole person, right?
Exactly, yeah. And this approach can be really effective in helping people manage their pain, improve their function, and get back to doing those activities that they enjoy.
It sounds like a really valuable resource, especially for those with that chronic pain who have, maybe struggled to find relief with other approaches.
Absolutely. And I think this whole kind of overview of all these different exercise modalities really highlights an important point. There's no one right way to exercise for low back pain.
I was just thinking that, yeah, it's like we've opened up this huge toolbox, and it's filled with all these different tools, but each tool has its own specific purpose and its own strengths.
Exactly. The key is to choose those tools, or in this case, those exercise modalities
Right.
that best align with that patient's preferences,
Yeah.
their physical capabilities, their access to resources, and of course, your experience and comfort level as the practitioner.
So it's really about finding the best fit for each individual patient, rather than trying to apply a one-size-fits-all approach.
Exactly. It's a very collaborative process, working with the patient to find what works best for them and what helps them achieve those goals.
I love that approach. It really empowers patients to take an active role in their own recovery.
Yeah.
They become partners in their own care rather than just passive recipients.
Absolutely. And I think that's, when we get the best outcomes.
Okay, so we've covered so much ground here. We've talked about, addressing that fear of exercise. We've explored all these different types of exercise, and we've really emphasized the importance of personalized care. What a journey this has been.
It has been quite the exploration. But we've mainly focused on exercise as a way to manage existing low back pain.
Right.
What about using exercise to prevent back pain from happening in the first place? I think that's a whole other world to explore.
Absolutely. That has the potential to be really impactful for our patients. So let's shift gears and dive into that exciting world of prevention. So we've talked a lot about treating low back pain, but now let's talk about preventing it. That's got to be a game changer for our patients, right?
Absolutely. Prevention is really where it's at. It's about giving our patients the tools to, take control of their back health and hopefully avoid those painful episodes altogether.
I like that. It's like we're arming them with a shield to deflect all those aches and pains.
Exactly. And exercise is one of the most powerful weapons in that arsenal. Whether we're talking about preventing back pain in someone who's never had it before or preventing it from coming back in someone who has.
Right. And we've been using those terms, primary prevention and secondary prevention. So just to remind everyone what those actually mean.
Sure. Primary prevention is all about, keeping those backs healthy from the get-go, preventing low back pain in people who've never experienced it. And then secondary prevention is all about stopping those backaches from coming back, preventing recurrences in people who've had back pain in the past.
Okay, so primary is all about building a strong foundation, and secondary is about reinforcing that foundation to make it even stronger.
Exactly. And the great news is that exercise can play a huge role in both.
Perfect. Okay, so let's talk specifics. What kind of exercises are most effective for primary prevention? For those lucky folks who've never had to deal with back pain.
Well, you don't need anything super fancy or complicated. A good mix of strengthening and stretching exercises done regularly can make a world of difference.
Okay, so back to basics. But what areas should we focus on? What are those key targets when it comes to strengthening and stretching?
I mean, the core muscles are key.
Okay,
They act as that natural brace for the spine,
right.
and then improving flexibility helps maintain a healthy range of motion.
Okay, so core strength and flexibility. Those
Yeah.
are our two pillars.
Yes.
Can you give us some examples of exercises that really target those areas?
Sure. So for core strengthening, you have your planks, your bird dog, bridges.
Oh, yeah, the classics. I can feel my abs engaging just thinking about those.
And for stretching, we have hamstring stretches, hip flexor stretches, and the good old cat-cow.
I love the cat-cow. Those all sound familiar, like from yoga or Pilates.
Exactly. You'll find a lot of these exercises in different modalities, so the great thing is people can incorporate them into a routine they actually enjoy.
All right, whether it's yoga, Pilates, or just, taking a few minutes at home to stretch,
It all counts.
it all counts.
Yeah.
Love that.
Yeah.
Okay, so the key here is consistency. Right.
Yeah, aim for at least 2 to 3 sessions of strengthening and stretching each week. And really encourage your patients to make it a non-negotiable part of their routine, like brushing their teeth.
Exactly. Make it a habit. Okay, let's switch gears to secondary prevention now. What are some of the key considerations for people who are trying to prevent that back pain from coming back again?
So for secondary prevention, the focus often shifts to, maintaining the gains you've made during treatment
Yeah.
and continuing to strengthen and stretch those back muscles. It's really about building on that foundation and making it a lifelong habit.
So it's about not letting those muscles, get lazy and lose all that hard-earned progress.
Exactly. And of course, the exercises are going to vary depending on the individual's history, their current fitness level, and any other underlying conditions.
Of course, personalized care. But in addition to those strengthening and stretching exercises, Are there any other modalities that might be helpful for secondary prevention?
Definitely. So yoga, Pilates, Tai Chi, those can all be great options because they offer the added benefits of mindfulness, stress reduction, and balance. And those can all contribute to a healthier back and reduce the risk of future pain.
So it's like we're coming at it from all angles, strengthening, stretching, managing stress, improving balance. Sounds like a winning combination to me.
Yeah.
But what about, just those everyday habits? Are there things people can do outside of those formal exercise sessions to help prevent back pain?
Absolutely. So posture's a big one.
Okay.
Encourage your patients to pay attention to how they sit, stand, how they lift objects.
Right, because we all know slouching over our computers all day isn't doing our backs any favors.
Not at all. And encourage them to take breaks. Even standing up to stretch for a minute or two every hour can make a big difference.
Those are great reminders. It's all about being mindful and making those little choices throughout the day to protect our backs.
Exactly. And it's those small choices, done consistently, that really add up.
Absolutely. This has been such an informative deep dive. I feel like I've learned so much, not just about how to treat low back pain, but also how to prevent it.
Me too. And I think that's the key message we want our listeners to take away. Movement is medicine, and it has the power to help your patients live healthier, more fulfilling lives.
Absolutely. So whether you're a marathon runner or just starting to incorporate exercise into your routine, remember, your back will thank you for keeping it moving. Thanks for joining us on this deep dive into low back pain. We'll see you next time for another deep dive into the world of health and wellness.